Hi, this is Haman Lawson. What I have found in the state of Virginia board's website on counseling, there were two cases where counselors were suspended for their involvement in dishonored payment. And one counselor was suspended for disclosing confidential information to the third party without the permission of the client. And one counselor was unsafe to practice substance abuse counseling without treatment, but eventually got the license granted. And two counselors were involved in dual sexual relationships with clients, and their license were suspended. And one counselor's license was terminated because the counselor made the diagnosis unethically. Favoring the wife over the husband in their process of getting separated. So that counselor's license was terminated. And how might self-care or lack result in counselor impairment? I believe that it affects them greatly because I just cannot imagine these counselors doing these things with their right minds. I'm assuming these counselors had to be going through some kind of trauma, sadness, or problems, difficulty in their personal lives to unclear their ethical, their intellectual, professional minds, allowing themselves to do such, knowing that what they're doing is clearly wrong, over and against everything they have learned, practiced, and believed. I just cannot imagine them doing this with the right minds. I mean, I would like to believe that they have been affected by some tragedy or trauma in their personal lives for them to choose such wrong decision, unprofessional decisions in their professional life as counselors. And what does the ACA Code of Ethics say about impairment? There's only one place where it mentions the impairment, which is C2G. It says counselors monitor themselves for signs of impairment from their own physical, mental, or emotional problems and refrain from offering or providing professional services when impaired. They seek assistance for problems that reach the level of professional impairment, and if necessary, they limit, suspend, and terminate their professional responsibilities until it is determined that they may safely resume their work. And counselors assist colleagues or supervisors in recognizing their own professional impairment and provide consultation and assistance when warranted with colleagues or supervisors showing signs of impairment and intervene as appropriate to prevent minimum harm to clients. So clearly, according to this, when the professional impairment is detected, the counselors need to take time away from their professional life to heal from whatever that they're going through, so they can offer professional service to the clients. And it's asking counselors to be accountable to each other when they suspect impairment in each other, that they be the assistant to each other to help them to recover from that, so that they may prevent harm to clients. I mean, the main point that I've been learning is that counselors do everything they can to avoid harm to the clients. So the self-care, well-being of counselors is vital, not only for the counselors, but most especially for the well-being of the clients. And according to the textbook that we read, I mean, it clearly points out how such distress and burnout and impairment can cost their professional life. And according to this, that it's gonna show in their uh, life as a professional counselor, and it says that such impairment can cause them to the inability to deliver competent patient care, and this can also cause the blurring of therapeutic boundaries that can lead to sexual exploitation of clients. And it emphasized it's that incompetence raises the risk that clients might be harmed. So clearly, that anything that can cause harm to clients needs to be avoided, and self-care is one of the vital thing that counselors needs to concentrate on to make sure that they don't do anything to cause harm to the clients. And what is the question this brings to my mind is that when I was going reading, studying the case decisions offered by the state of Virginia board's website on counseling, is that I was just totally shocked. Um, there are two cases where the counselors were suspended for their involvement with dishonor payment, and there were two counselors who were involved in dual sexual relationship with clients, and their license were not terminated but simply suspended. Only one who lost the license is a counselor who made unethical diagnosis over the client in order to favor the client's wife as they go through the process of separation. The counselor only met with the client one time and made a diagnosis mostly based on what the wife said about the husband. So because of that unethical decision, that counselor's license was terminated. However, the counselors two cases where they had dual sexual relations with clients. One case has detailed explanation of how it happened, and according to that record, that counselor intentionally, purposely ruled the client into having this sexual relationship. According to the report, that counselor invited the client into the car and into the back seat where they had sexual relationships, and that caused such trauma and brokenness in the life of client. And when this counselor purposely intentionally made plan to lure the client into having the sexual relationship, and this counselor did not lose the license, but the counselor's license was only suspended, not terminated. That just surprised me, because to me, that was bad enough to lose counselor. And we emphasize not harming our clients, and what this counselors did in order to please themselves, they caused such brokenness, such harm into the life of the client and into the marriage of the client, yet they did not lose their license. That was quite surprising. That was shocking for me, that they really did not lose their license. But overall, it clearly tells me that the self-care of counselor is vital. It's very important, not only for the safety of the counselor, but the mostly well-being of the clients. Well, thank you so much for listening, and have a blessed day. Bye.